Good afternoon. I'm very pleased to welcome all of you, to the Capitalizing Health and Human Housing Forum. I would like to thank Enterprise Community Partners, the NYU Furman Center, and our colleagues from the Federal Reserve Bank of San Francisco for partnering with us on this joint effort. My name is Anand Mari. I am the head of Outreach and Education for the Federal Reserve Bank of New York. Before I continue, I must state that my comments here today reflect my own views and not the views of the Federal Reserve Bank of New York or the Federal Reserve System. I want to take a minute to explain how the New York Fed conducts community outreach in order to give you all a better sense on how to engage with us in the future. The bank's outreach and education function is responsible for engaging with communities across the New York Fed's districts, which includes the New York State, the 11 counties in northern New Jersey, Fairfield County in Connecticut, Puerto Rico, and the U.S. Virgin Islands. The bank's outreach efforts aim to make relevant and objective information available to as broad a group of constituents as possible. Through our collective outreach efforts, the bank impacts the communities we serve, strengthens public trust in the organization, and leverages the skills and talents of our colleagues across the bank. The bank's outreach efforts fall into three broad action items. We inform, we engage, and we support. We inform by developing independent research and analysis, along with corresponding conferences like this, and clinics are organized around economic topics across the district at all levels to help inform public debate and individual decision-making. 2, we engage by meeting and listening to Main Street audiences across the district, such as this forum today. The bank's leadership and other professionals meet with a variety of constituents to better understand the real economy and to share the bank's research and analysis. Our engagement maintains an active two-way dialogue with the people and businesses in the region. 3, we support educators and students through a series of programs and products that foster greater awareness and understanding of the roles and responsibilities of the Federal Reserve System. Given our limited resources, we focus our outreach efforts in low and moderate income communities on a discrete set of topics aligned with the bank's mission and expertise, including household credit, community indicators, small business, education and school funding, and workforce development. Lastly, we also have a museum learning center that serves as a hub for connecting with the public through a variety of programming, which includes guided educational tours, programming for K-12 students and educators, and related community outreach initiatives. And besides, everybody wants to see the $500 billion worth of gold downstairs, so that also helps. We're co-hosting this meeting because we believe this is an important and timely topic for low and moderate income neighborhoods in New York City and beyond. In Harlem, where I live with my family, there's a high rate of childhood asthma. It is well documented that poor housing quality, housing with mold infestations, broken plaster, peeling paint, are triggers of asthma. Asthma attacks in children can lead to missed school. As an educator by training and by profession, I understand that the cascading efforts of chronic absence from school, this is just one dimension of the effort of poor quality of housing, the effect of poor quality of housing on communities. Today, the panels will be discussing innovative strategies of pairing healthcare resources with traditional affordable housing financing to intentionally transform the health and well-being of low-income families. As the health and housing space gets more traction, we will all need to put our heads together to create more opportunities to strategically and creatively use our resources. Before I close, there are a few housekeeping items that I need to cover. First, please do not use your cell phone on the 10th floor, even in the hallway outside this room. During the break, if you need to make a call, our staff in the back will direct you to the 11th floor. Second, you could feel free to tweet, post to social media about today's discussions, all you like. There's no release, we've released that. There are a few members of the press in attendance, and you can identify by their name tags. And most importantly, the restrooms are just located past the reception area, and staff will direct you once you exit the room. And as I finish, a reception will follow immediately after the panel discussion downstairs in the West Wing. And thank you again. We'll look forward to a productive conversation. So now Mark Willis, Executive Director of NYU's Furman Center for Real Estate and Urban Policy, will be coming.
Thank you, Aman. Well, good afternoon. All right, a little more energy here. Well, I know we're all going to be here for a real treat of information and excellent discussion this afternoon, so we want everybody here to be on their toes. So it's great to see so many of you here. I think as many of you know, the demand for this conference was very high, and unfortunately some people that wanted to come aren't able to be here, but I do want to let you know that we will be posting a video so they will be able to enjoy it. And for those of you who want to relive the experience, you also can see the video. The hashtag is here, hashtag healthy housing. We encourage tweeting here, and if somebody wants to come and show me how to do it, I would be happy to participate in that. So as many of you know, this is the second in a series that Enterprise and the Furman Center have hosted, and we are thrilled that the New York Fed and the San Francisco Fed have joined us in shining a light on health and housing. And of course, we want to particularly thank the New York Fed for hosting us here today. So the first convening was last February, and we explored the why of health and housing. Really, is it connected, and how should we be breaking down silos and working to find solutions together? So we learned a fair amount there, and I'm on the research side. We got a lot more research to do. But the momentum we generated by that convening is really led us to turning today to the challenge of finding ways for the health and housing communities to work together and to maximize the effectiveness of our health, housing, and community development dollars. So when you are leaving here, you can just leave your suggestions at the door, and we will hopefully have solved all of these problems. But I think we all realize that this issue of wrong pocket and how do we get two areas that have developed in some ways independently to really talk together and to work together and hopefully combine resources so that we can really make an effective difference in our communities. So with that, let me just turn to my main role here. I have the opportunity here to introduce the speaker for today, Don Schwartz of Robert Wood Johnson. He's pioneered in this area. I think you all have his resume in front of you, but I'm going to point out some parts of that just because I think we're particularly honored to be able to have Don with us. So it is Dr. Donald Schwartz. He oversees the Robert Wood Johnson Foundation's effort to identify, support, and spread the word about individual and community actions that promote lifelong health for all Americans. He joined the foundation in July 2014. Previously, Dr. Schwartz was Deputy Mayor for Health and Opportunity and Health Commissioner for the City of Philadelphia. In his role as Deputy Mayor, he oversaw the Departments of Human Services and Behavioral Health and Intellectual Disability Services and the Office of Supportive Housing. Before entering government service, Dr. Schwartz served as Vice Chairman of the Department of Pediatrics at the University of Pennsylvania School of Medicine, Deputy Physician-in-Chief and Craig Delsmer Division Chief for Adolescent Medicine at the Children's Hospital of Philadelphia. He was also Mary D. Ames Professor of Pediatrics in the University of Pennsylvania School of Medicine and Nursing at the Children's Hospital of Philadelphia, and a Senior Fellow at the Leonard Davis Institute for Health Economics at Penn. Dr. Schwartz was an active researcher in the area of adolescent risk behaviors for over 22 years. It is clear we would be hard put to find somebody better to be able to set us up for the conference this afternoon. Don?
All right, I will tap dance for a minute as technology works for us. Thank you, Mark. Thank you, Anand. I am delighted to be here and delighted to see everyone here to think about and share ideas about and explore and learn about the intersection between health and housing. Okay, I'm getting the direction. I'm good. Good. I think it'll work. Let's see. Yeah, okay. That's a beauty of being at the Federal Reserve. Things work. All right. So, I think, and in reflecting on what to talk about today, it occurred to me that we are at a really extraordinary moment for both health and housing. We're at a point where I think frustration on the housing side is probably higher than it's been in 30 or 40 years. And incentive on the healthcare side is higher than it's been certainly in my health lifetime. And the Affordable Care Act has brought health to that table. And unfortunately, growing poverty and the recession has brought housing to that table. And we are together trying to set a table, but it's very unclear how precisely we're all going to eat together. What we know is on the health care side, incentives now push health care institutions and health insurers to increasingly think about the social determinants of health, housing being a principal one. And there's rapidly growing knowledge, as hopefully you all know, about the health impacts of housing. At the same time, there are penalties, clear penalties for healthcare institutions who see people repeatedly who have potentially preventable or remediable conditions. And often the remedy has to do with the environment in which someone is living. We also know that if we look at the United States, this is a chart that shows life expectancy differences between the United States and 16 other Western nations. And what you see is that we have the worst, essentially, or next to worst life expectancy until age 65. And then by comparison, this is at any given age. So if I'm whatever age I am, let's say I'm 55. At age 55, you can see that my life expectancy is just slightly higher than one other nation, but 15 places that I could live would have better life expectancy for people of my age. But we have extraordinary life expectancy for 95-year-olds. We are the best in the world. And what that means is that we all would have wonderful long lives, except we'll all, not all, most of us will be dead by then. So we as a country have chosen to invest in a slim slice of our population, and we don't only invest a little, we invest a whole lot. So hopefully you know that of the $450 billion that we spend on Medicare, somewhere between a half and a third and a half goes to people who are in their last 6 months of life. So seniors are important to us. No one would deny that it's important, but we have invested in a healthcare system that's designed to keep people alive at the very end of life, no matter what it costs. And I think we are about to become engaged in a conversation about, is it that period of time where the quality of the rest of this that's more important, and what do we need to do so that smoking and poor housing and serious illness aren't causing most people in this country to die earlier than people in the rest of the world. You all hopefully have seen zip code maps. David Erickson is going to come up and tell us that zip code is more important than genetic code. We've got him on board. This is New York. Hopefully you all know that. And if we ride one of the major subways in New York, you can see that in just a few stops, people lose 10 years of life expectancy. Place matters. For the Robert Wood Johnson Foundation, we have increasingly focused on place mattering and have tried to figure out what it is about place and what we do about place. So if we know place matters, how do we remedy that? And what's the role of health and health care in thinking about better placemaking? And that's not simple. What we know is, this is from Tom Frieden, who was the health commissioner for the city of New York until he became the director at the Centers for Disease Control. And he created something called the Health Impact Pyramid, which shows which factors have the greatest impact on health. And you can see, no surprise to anyone in this room, hopefully, that socioeconomic factors have the greatest impact, and then the contexts in which we live. The lowest set of impacts come from those top 3 areas, which are things affected by health care services. But food environments and primary care access and transportation, housing, jobs, and education, as we all know, make and have the greatest impacts on health. They're also, in some ways, people would say the hardest to change, although what I would say to you is, if we look at the top of the pyramid, it has proven particularly vexing to figure out how to effectively educate and counsel people in this country to change behavior. So while we think of the top of the pyramid as having limited impact at a population level, we're spending a whole lot of money in those top 3 parts. And I think the conversation today is about whether we might find ways to take some of those dollars and invest them in a different part of the pyramid. The Robert Wood Johnson Foundation is building a culture of health in America. Hopefully everyone here has heard that slogan. We want the next generation to live in an America where health is an enduring cultural value and health drives all decision-making in our society. Everyone will think about the health impacts of all the decisions we make. And we have 4 particular action areas. Number 3, not related to importance, is creating healthier and more equitable communities, which is why I'm here today and hopefully why you're here today. I want to, though, go back and ground this in something that's important to me as a pediatrician. This is Todd, for all of you in the healthcare sector who are nervous, no HIPAA violation. Todd comes from the front page of the Philadelphia Inquirer on November the 5th, 2010. Todd has asthma. Todd's mother, Myra, was a nursing assistant until 2007 when she lost her job. And with that, she could no longer afford to pay utilities. And her landlord, because she only intermittently paid rent, didn't do a very good job of maintaining their apartment. So at the time of this article, Todd was not only hungry, and the article highlighted his hunger and the impact of hunger on his frequent admissions to the hospital for asthma, but also on the conditions in which they were living and the impact particularly of losing electric power on Todd's ability to have nebulization treatments. So I could do a whole argument about Todd himself. Each time Todd was admitted to the hospital, if we look at the average in Philadelphia, it cost the Medicaid program somewhere between $70,000 and $250,000. And if he went to the intensive care unit, those numbers doubled. Todd's a really expensive kid who's getting nothing in terms of quality of life for our investment. So, people have looked now, and you probably know the studies better than I do, at various aspects of housing and their impacts on various aspects of health. And as Anand mentioned, we know that asthma and housing are critically connected. What is often forgotten is that housing has very broad impacts on health. This is a study that I like a lot that looked at 2,437 low-income children and adolescents and looked at more than 45 factors and found that housing and factors about housing had particular impact, long-term, on the behavioral and emotional development of those children. And in fact, of the housing factors, the quality of housing made the biggest difference to those children's emotional and behavioral health. And we could all begin to understand that, since most children are housed, and if you're housed, it's the surroundings in the house that make a difference. So quality is critical. But all 5 of these factors were important. We can't lose sight of that. And in fact, if we take those factors and we look at the many hazards and the many kinds of harm to children and the many impacts over time, we make not only a strong but an interesting argument about why early investment in housing makes a difference to lifelong health expenditures. The problem we have, and I believe it will be talked a little bit about today, is that from an investment point of view, it's a really long time between the 5-year-old who's living in a cold and dirty dwelling and the 50-year-old who has chronic heart disease and is costing the system a bundle. But people are beginning to make the argument, and people are beginning to say, let's look at the pathway between early investment and later return, and let's think about all of those systems and governments, private and public sector agencies that should have some willingness to invest early for those later returns. What we say is that it's not just housing quality, it's housing